Now we will continue from the point where we had stopped last. The next part is about the drug regimes or yogas which could be used for the treatment of Atisara. Yogas Chatra Prokshante Tvam Atisaranashanaha Kalinga Ativisha Hingu Sauvarchala Vacha Abhayaha Devadaru Vacha Musta Nagara Ativisha Abhayaha Abhaya Dhanyakam Mustam Pippali Nagaram Vacha Nagaram Dhanyakam Mustam Varakam Vilome Vacha Mustam Parpadakam Shunthi Vacha Prativisha Abhaya Abhaya Ativisha Hingu Vacha Savarchalam Tatha Chitraka Pippali Moolam Vacha Katukarohini Patha Vatsaka Bijani Haritakyo Mahoshadham Murva Nirdahani Patha Trushanam Rajapippali Siddhartaka Buddhadaru Shadahva Katurohini Jela Savarakam Kustam Haritre Kautajaha Yavaha Meshashindi Pagete Krimigdham Vrukshakanicha Vrukshadani Virataruhu Bhratyo Desahe Tatha Aralutpaka Taindukicha Dadimi Kautami Shami Patha Tejavati Mustam Pippali Kautajam Phalam Patolam Dikpiko Bilbum Harite Devadavacha Vidangam Abhaya Patha Sringaveram Ghanam Vacha Vacha Utsaka Bijani Saindhavam Katurohini Hingu Hingu Vatsaka Bijani Vacha Bilva Shalatcha Nagara Ativishe Mustam Pippalyo Vatsakam Phalam Mahoshalam Prativisha Mustam Cha Itya Amapachanaha Prayodhyaha Vimshatihi Yogaha Shlokartha Vihitastuime Dhanyamla Ushna Ambu Madhyanam Pibe Danyatamenava Nishkwathanva Pibe Desham Sukosnan Sadhasarvitanam. The main line of treatment of all Atisara is the Amapachana. And for Amapachana, Sushruta has suggested around 20 yogas. And the 20 yogas, each of these, half of the shloka, each line of the shloka suggests about a possible combination. Majority of these combinations would have Patha, Abhaya and Vatsaka. That's Kutaja. These are the major important conditions, and Mustaka. These are the major important contents of all the yogas. The purpose of giving 20 or more than such multiple yogas may be from the point of view of availability, any of those substances which are available at that area, or even it could be to consider the possible permutation and combination of dosha of the patient as such. Any of these yogas could be present or administered with either dhanyamla or simply warm water or madhya, some alcoholic preparations in the form of asavarishtas, or simply kashaya after removing all the skin or barks of these plants, trees, they could be given as such. So either simple kashaya or with the dhanyamla or with the madhya preparations, alcoholic beverages could be considered as one of the options. Then other yogas, Payasi Utkhatya Mustanam Vimshatim Trigodam Dhasi Kshira Avashishtam Tatpitam Hanti Amam Shulamemaja. Kshirapaka with Musta and Musta 20 times, high quantities of Musta with 3 times water can be prepared, and it is an excellent medicine for Amashula, pain during the Amatisara. Nikhile Upadishto Ayam Vidhi Amopashante Haritakim Ativisham Hingu Savarchalam Mucham Pibet Sukhambana Jantu Amatisarapratishedha. All these protocols which are mentioned are for the Ama, and one of the specific yoga which could be used for all variety of Ama is Haritaki Ativisha Hingu Savarchalavana Vacha. These can be given. Patolam Deepikam Bilvam Vacha Pippali Nagaram Mustam Kustam Vidangancha Pibe Dvapi Sukhambana Shungaveram Guduchinja Pibe Dushnena Marina Lavanani Atha Pippalyo Vidangani Haritaki Chitrakam Shinshapa Patha Shargestha Lavananicha Hingu Rukshaka Bijani Lavananicha Bhagashaha Hastidanti Atha Pippalyaha Kalkau Akshasamo Smito Vacha Guduchikandani Yogoyam Paramamataha Yete Sukhambuna Yogaha Deyaha Panchasvarmataha. Another set of 5 yogas are mentioned by Sushruta, and those are again the contents are self-explanatory, and these can be given as Amapachana. Nivrteshu Amashuleshu Yasyana Praguno Anilaha Stokam Rujam Cha Sashulam Yo Atisarete Sakshara Lavane Yuktam Mandagni Sapabed Bhradam If a patient after the ama lakshanas are over, even after the lakshanas of Pakwatisara have occurred, but still the patient doesn't have a proper bowel movements, instead patient may have repeated episodes of small quantities of the stools pass with the pain, which we now call as dysentery, a dysentery complication, or where the established colitis occurs. In such conditions, Sushruta suggests about a Kshara Lavana with the drug Ghrita. A Ghrita with the Kshara and Lavana has to be given because the Agni has become Manda in such conditions. Kshira Nagara Changeri Kola Dadhi Amlasadhitam Sarpi Hacham Pipedvapi Shulatisara Shante. Other option for Shulatisara. That's Shulatisara is a situation where the patient would have passed frequent stools with pain even after these fecal contents seem to be digested. A digested fecal content is excreted out, which we now call as dysentery. In such conditions, another yoga is the Nagara Changeri Kola, this Kshirapaka with the Ghrita. Dagna Taila Ghritam Pakum Savyosha Jati Chitrakehi Sabilva Pipadi Mula Dadi Meru Arugamitehi Nikhilo Vidhiruktoyam Vata Shleshmopashante. The other yoga is Gati with the Taila Ghrita and the drugs like Trikoto and so on, they are to be used. And Tikshnosna Vardyam Enam to Vidadhyat Pittaje Vishaka. If the patient has Pitta Lakshana, you may select the yogas with the same, but avoid all Tikshna Dravya and Ushna Dravya. Yathauttam Upavasante Yavagusha Prasyasite. The other option is Upavasa, where the patient is given very little food and easily digestible light food, and at the end of that Yavagu has to be given. Balayoho Amshamatyam cha Shadam Shrabhati Shuja Shatavarya cha Sansiddhaha Sushitaha Madhusanitaha. The next part, once the patient has recovered and has a better appetite, to facilitate the patient, you may give the drugs with the madhu, honey, the amshumati, shodamsta, brihati, shatavari, etc. Muddadisha yusha sudrabyehi etehi susanskrataha. A green gram yusha, that's the ganji prepared with the green gram, can be given as again to improve the general condition of the patient. Now specific yogas, depending upon the dosha. In case of Mrudubihi Deepanehi Tiktehi Dravehi Syad Amapachanam Haridra Atibisha Pata Vasa Bija Rasanjanam Haridre Bijani Kutaja Pata Guduji Bunimba Hatasiva Katarohini Eteshi Hokar Nirtiste Kwata Sip Pitta Pachanaha. If the patient has a Pitta Jalakshanas, in this condition Mrudu Deepana Dravya have to be given. Examples like Haridra Atibisha Pata etc. With this you may have to give treat the patient, and each of the half of the shloka, each line, the contents mentioned in each line is a independent yoga to be administered in such conditions. Then other yogas which also can be used in Pittaja Vyadhi are Pittajam Mustam Kuttaja Bijani Bhunimum Sarasanjanam Darvi Duralabha Bilum Balakam Raktajandanam Chandanam Balakam Mustam Bhunimum Duralabham Mranalam Chandanam Rodram Nagaram Nilamutpalam Patha Mustam Haridre Dve Pipadi Kautajam Palam Falaktajam Utsakasya Shandaveram Ghanam Vaja Shadete Abhita Yoga Pitta Atisara Nashanaha. These 6 yogas, which are again mentioned in each line, are suggested for treatment of Pittaja Atisara. Bilva Shakra Yava Ambo Uda Balaka Ativishakrataha Kashayo Hantyatisaram Samam Pitta Samudbhavam Pittaja Sama Atisara treated with Bilva Shakra Bilva etc. Madhuka Utpala Bilva Abda Hribera Ushira Nagarehi Kritak Patho Madhuitaha Pittatisara Nashanaha. Another yoga for the Pittatisara, Madhuka Utpala etc. have to be given. Yada Pakopi Atisaraha Saratyevam Hurmuhu Grahanya Madhavantoho Tatra Stambhanam Hitam. A Stambhana treatment or a Kashaya Sandravya, which is supposed to suppress the urge for defecation, would be indicated only when, even after the full digested particles coming out, but the patient still continue to pass frequent stools, stools which a diarrhea which persists for a long duration, which we now call as chronic diarrhea, which is persisting for a long duration. And in that condition, there would be an abnormality of the grahani, though Sushruta has not mentioned that vyadhi as a grahani vyadhi, whereas in the later textbooks, the disease is named as grahani vikara. Now, in such condition, stambhana is indicated. The such stambhana dravyas are kashayatikrasas, and the examples are samanga, dhataki pushpam, manjishta, lodhra, musagam, shalmali, vestakorodhram, vriksha, dadimeva, tvachohu, आम्रास्ति मध्यम लोध्रम च बिल्व मध्यम प्रियंगवः मधुकम शृंगवेरं च दीर्घवृंतत्वगेव च चत्वार एते योगाः स्युः पक्वातिसारनाशनः उक्ता ये उपयुज्याः ते सक्षौद्राः तण्डुलाम्ना. These four sets of yogas, and among them the quite important are Rodra, Mustaka, Rodra, and Amrasti, that the mango seeds, the inner core seeds, core part of the seed of mangoes. These are the important and which are often used in the folklore practices also, and they are indicated in Pakwatisara when the patient has a persistent diarrhea even after a long period and the appetite is better. In such conditions only these are indicated. Mostam kashayam ekam va peyam madhusamaitam lodhra ambu priyam vadin ganan evam prayajeta. Musta kashaya. Musta is considered as one of the favorite drug by Sushruta, and which can be given with the madhu or lodhra, ambasta, etc. can be given. Padmam, samangam, madhukam, billo, jambu, shalataja, pibet tandulatoyena sakshaudram agadankaram. And if there is a gadaja or vishaja atisara, toxic diarrhea, in such conditions, padma, samanga, madhuka, bilwa, these are given. Kachuhu amula kalkamma, kachra mula kalkam, vapi udumbara falopamam, payasya chandranam padma sita musta abjakesharam, pakvatisaram yogayam jayet pitasya shonidam. If there is a hemolygenous discharge, like during the fecal content, this diarrhea, a diarrhea with blood, a blood mixed diarrhea, in such conditions, the suggested treatment is a kachura mula kalka, kachora mula kalka, and udumbara phala, and payasya, that's chazavali, chandana, these could be given. Nirama rupam shulartam langhanadyeshcha karchitam naram vruksham avesha agnim saksharam paye gridam. Once the ama lakshana has been removed or the stools have show the evidence of digestion, but the patient has still pain due to the emaciation or langhana, in such conditions, considering the ability, power of the Agni, Ghrita has to be given with the Kshara. Bala Brihati Amshumati Kachura Mulasaditam Madhukshitam Samadhukam Pibet Shulehi Abhitrutaha. Another of the drug combination which could be used for Shula, the pain, is Bala Brihati Amshumati, etc. Darvi, Bilva, Kana, Draksha, Katuka, Indra, Evai, Gritam, Saditam, Hanti, Atisaram, Matapitta Kapakam, Datnacha, Amblena Sampakum, Savyosha, Jaji Chitrakam, Sachavya Pipali Mulam, Dadi Melva, Rugadvitaha. Another of the yoga which could be used for the pain, symptomatic treatment of the pain. Payo Ghastam Madhu, Chapibe Shulehi Abhitrutaha, Sita, Ajamota, Katvanga, Madhuki, Avachurnitam. Avedam Susampakam Diptagne Sujirochidam Nana Varna Matisaram Putapake Pacheta. If the patient has developed a chronic one and chronic diarrhea, and the patient doesn't have much pain but passes and has a good appetite, and condition has become chronic, and the Atisara diarrhea still persists, in such conditions, Putapaka yogas are used. Putapaka yogas are very specific combinations, and one of the examples of the Putapaka yoga is Tokpindam Dirghavrintasya Padmakeshara Sanyutam Kashmiri Padmapatreshcha Aveshcha Sutrena Sandradam Mrudo Avaliptam Sukrutam Angareshu Avakulayet Swinnam Udhrupya Nishpidya Rasam Adayatam Tataha Sheetam Madhuyitam Krutva Payeta Budarame Jivanti Mesha Shrinkyadishwevam Dravyeshu Sadhayeta. Putapaka yoga is a very specific method of preparing the drug where the drugs, raw drugs, are covered with mud, and that mud ball is kept over fire and heated, and after heating the mud ball is broken down and the juice of that cooked or heated drugs are taken in, and that's the Putapaka yoga. And The combinations could be like the Padmakeshwar, etc., Kashmiri. These drugs could be used for that. And the other yogas which could be used for Udara, where the patient has developed an established pathology, Atisara can result in a complication of Udara. In such condition, Tittirim Lunchitam Samyaka, Nishkrusta Atram tu Purayet, Negrodhaditvajam Kalkehi, Puruvacha Vakulet, Rasamadaya Tasya Atha, Sustinasya Samakshikam, Shakaro Pitam Shikam Payet Udarame, Tittiri bird, that it's something like a variety of the small household birds like which we call as maybe variety of parrots. That's a variation of parrots. The flesh of these birds are taken in, and the intestines have to be removed, and this has to be prepared in the form of putapaka with the negrodhadipaka, and that juice is given. लोद्र चंदन यश्चाह्व दार्वी पाठ सिदोत्पलान् तंडुलोदक संपिष्टान् दीर्घ वृंतत्वगन्वितान् पूर्ववत् कूलिता तस्मात् रसम आदाय शीतलं मध्वाक्तं पाये कफपित्तोदरामे. If there is a kapha-pitta vyadi, again this putapaka yoga is prepared with the lodra chandana etc. एवं प्ररोही कुर्वीता वटादीनां विधानवत् पुटपकान् तथा योगं जागल उपहितान् शुभान्. Again putapaka with the other different these fresh leaves of vata etc. That's Bengalensis, ficus varieties of the plants are to be used. बहुश्लेष्म सरक्तं च मंदवातं चिरोत्थितं कौटजं फाणितं वापि हन्ति अतिसारं मोजसा अम्बष्ठादि मधुयुक्तं पिपल्यादि समन्वितं. The बहुश्लेष्म, if there is a significant persistence of mucus and blood, a mucus and blood mix stools, that's again chronic dysentery, and the patient has mandavata, the peristalsis has become slower and very chronic condition. In such a kutaja phanita or ambastadi gana dravya. Now ambastadi gana dravya is the interesting issue. A kashaya rasa mainly kashaya tikta rasa dravyas, but they are vairejanika yogas. They induce virejana, but they have to be administered with the pipalyadi gana in such conditions. Prishniparani bala bilva valaka utpaladhanyakaihi sanagaraihi pibet peyam sadhitam udaramahi. That Udara Vyadhi, once the patient has established chronic diarrhea conditions, in such chronic diarrhea established for a long duration, and back you have a established disease like maybe colitis, ulcerative, or maybe the other Crohn's disease, etc. Then in such conditions, Prasiparani Bala, Bilva, Valaka, Utpaladhanyaka, these drugs are given in the form of peya. Aralutwaka Priyam Mudukam Dadimankuran, Avapya Pishtwa Dhani. Yavagum Sadhe Dravam, Esha, Sarvan Atisara, Hanti Pakwana Samshev, another of the yoga for Pakwatisara. Rasanjanam Satibisham, Twagbijam Katan, Kautajam Tada, Dhataki, Nagaram Chiva, Payet, Tandulamana, Sashulam Raktajam Dhanti, Yete Mudusamaitaha, bleeding per rectum with that hemogenous discharges of stools, another of the yoga, Rasanjanati Visha, etc. रसायनम सातिविषम त्वग्बीजम कोटजम तथा धातकी नागरम जीव पाये तंडुलामना सशूलम रक्तजम दंती येते मधु समाहिताः. Another of the of course it's the same repetition, sorry. बदरी अर्जुन जंबु आम्र शल्लकी वेतसत्वजः शर्करा क्षौध संयुक्ताः पीताः नन्ति उदरामयम्. Another of the yoga used to for the udara. येते देव यवाकुंश षडान् यूषांश्च कारयेत् पानीयानि च तृष्णासु Dravyeshu Yeteshu Buddhimana. The Yusha or Shada is a thicker paste ganji. Is to be prepared, or Yavagu is a very thinner paste as such. These could be given in if the patient has become thirsty. Kritam Shalmari Vranteshu Kashayam Himasamnidam Nisha Paryushiram Payam Sakshaudram Dukanidam. Shalmari Hima with Kshaudra also can be used for the thirst produced in such condition. Shakarta yestu samsistam atisariyata shonitam prak paschadva purishasya saruk saparikartikaha kshirashrunga shrutam sarpihi pibet sakshodav sharkaram. One of the frequent complications of all diarrheal disorders is a irritation of the anal opening. Proctate may not be proctitis, but erosion of the skin around the area, and hence patient would pass the stools, but at the end of the passage of the stools there could be bleeding, some amount of bleeding, a few drops of blood, and painful condition, parikartika, there will be a lot of pain in the perineal area. And the yoga which is mentioned there is a Kshirashunga Shram Sarpihi, Kshirashunga Kashaya with the sarpi, honey has to be given. Vibadha Vatabit, Shulaparikaha, Sapravahikaha, Sarakta Pittascha Payaha, Pibe Trishnasamanvitaha, Yatha Amritam Tatha Kshiram Atisareshu Pujidam, Chirochiteshu Tat Payam, Apam Bhagehi Tribhishradam, Dosha Shesham Harektadi, Tasma Takshiramam Smudam, Hitaha Sneha Viryakova, Bastaya Pichirashe, Pichila Swarase Siddham, Hitam Tibhum Chede. If the patient has a alternating constipation and diarrhea, Vibadha Vatabit is where the patient has a constipation and then again there would be pain and then again a diarrhea, Sapravahikaha, or there would be bleeding, typical of Crohn's or ulcerative disease conditions. In such conditions, Kshira is, milk is indicated, and Sushruta says milk is something like Amrita, nectar. Interestingly, in the present day's trend, the ulcerative colitis, milk and milk products are often prevented. Another controversy. But what I do really practice is I do advise milk or this lassi, the bay water, etc. as a preparation choice as such. And then Pichabasti is indicated. Sneha Virechana and Pichalabasti or Pichabastis are indicated. Pichabasti is again regularly practiced. Shakarta Yastam system Atisariyata Shonidam Prak Paschabda Purishasya Sarup Sarapadikartikaha Kshirashundashram Salpi Beb Sakshodra Sharkaram. Again, this shloka has become repeated. Right? Okay. If the patient has a blood mixed stools, more of stools and lesser of blood, that's something like amoebic colitis like conditions, and there is perikartika, that perianal inflammation. Kshirashungashtara sarpihi is given. Gaurave umanam pathyam yasyasya prabhalakapaha jware dahe sabit bandhe marta draktapiktavad sampakve bahudushecha vivande mutashodhanehi karyam asthapanam kshipram tate anasanam. If the patient has a raktapitta like persistent bleeding and frank blood passes out, and the patient also has the symptoms like jara, daha, gaurava, vamana, that's heaviness, and in such conditions vamana is indicated, and because there is a prabala kapha, and astrapana and anuvasana also are indicated. Prabhahane gudabhramshe mutraghate katigrahe mudharambe ishtam telam sarpi vapyanasanam. Other complications which can occur due to the diarrheal disorders are there could be severe griping pain or gudabhramsha, prolapse of the anus, or mutraghata, dysuria or anuria, or pain in the pelvic girdle. In these conditions, taila prepared with madhura and amla dravyas can be given in the form of anuvasana. Taila or ghrita can be given in the form of anuvasana. Anuvasana basti is indicated. Gudapakastu pittena yasya dahitashinaha tasya pittarasekaha tatsiddhascha anuvasanaha. If the patient develops gudapaka, that's a proctitis or pus forming conditions, maybe abscesses in the area, which is quite common in case of ulcerative colitis like conditions. In such conditions, pittahara shakas are to be given. Dadi manda sura billo siddham tailam samarute bhojane chahitam kshiram kachuhu amula sadidam alpalpam bhusho raktam sarugya upayeshite yada vayurubhyascha picha bastis tudahitaha. If the patient has symptoms like frequent small amount of the stools passed with the blood, and vibadha, there will be pain in the abdomen, distension of the abdomen, in such conditions Pichabasti has to be given, and the patient may be given the food of dadi, manda, sura, bilva, taila, or kshira with the kachura mula. Prayana gududaurbaldhyam dirgha kalatisaranam bhavet tasmat hitam tesham ude tailavaccharanam. If the patient has a chronic diarrhea, one of the most frequent complications will be gududaurbaldhya, or abnormality of the anal sphincters. Different sorts of the dyssynergias can be triggered due to the diarrheal disorder. Particularly diarrheal disorders treated with the loperamide like drugs which reduce the motility. That's one of the frequent complications we see, and in such conditions Sushruta says Tailavaccharanam, administration of Taila. Shalaparni, Prishtaparni, Brihati, Kantakarika, Bala, Ashwadamsta, Bilvani, Patha, Nagaradhanekam, एष आहार संयोगे हित सर्वातिसारिणां. The substances which could be added to the food in the form of vegetables or other sources or shalaparni, prishvarni, brihati, which could be given along with the food as a protocol of treatment for all atisaras. Tilakalpa Hitaschatra Maggo Mudgarasastada. Tilakalka and Mudgarasa also are the Pacha. Pittatisari yo Matyaha Pittalani Atishevate, Pittam Pradushtam Tasyashu, Raktatisaram Avaheta, Joram Shulam Trishantaham Budapakam Chidaranam. A Raktatisara could occur in a patient who has a Pittaja Atisara, but he still continues to consume Pittala Aharas, and in such conditions it can result in systemic symptoms of Jara, Shula, pain, fever, etc. And Raktatisara, continuous persistent bleeding, ischemic colitis, is one of the serious complications of any diarrheal disorders. In such conditions, यो रक्तं शकृतः पूर्वं पश्चात् वा प्रतिसार्यते स पल्लवैः वटादीनां ससर्पिः साधितं पयः पिबेत् सशर्कराक्षौद्रम् अथवापि अभिमत्य तत् नमनीतम् अथो लिष्यात् तक्रं च अनुपिबेत् ततः. In such conditions, again Vata picha can be given in the form of pichabasti, or it can be given orally with the sharkara, kshaudra, etc. or namanita. Butter also can be given with them this buttermilk as a anupana. Priyala shalmani plaksha shallaki tinishattvajaha kshire vimritya pitaha sakshodraha raktanashanaha. Another of the yoga for bleeding per rectum. Madhukam sharkaram lodram payasyam athasarivam pibet chagena payasa sakshodram raktanashanam. For the bleeding conditions, the different yogas are suggested, and that's a Madhuka Sharkara, etc. with goat's milk. Manjishtam Saryavam Lodram Padmakam Kumudakvalam Pibet Pradnam Chadubhena Chagena Prashante. Another of the yoga which can be given again with the goat's milk. Goat's milk is another recommended drug substance which can be given. Sharkara Utpala Lodhrani Samanga Madhukam Tilaha Tila Krishna Sayeshyaha Samanga Utpalanicha Tila Mocharaso Lodhram Tadeva Madhukotpalam Kachura Tilakalkascha Yoga Tatvarayavta Ajena Paisa Peyaha Sarakte Madhusanyutaha. Another set of the yogas, the 4 yogas, each line suggesting one yoga with Adipayasa, that's Adipaya is goat's milk, can be given. Drave Sarakte Sravati Bala Vidlam Sapanitam Sakshautrailam Prageva Vishyadashitam Itata. Another of the yoga which could be used for the blood mixed stools. Koshakaram Grite Bristam Laja Churnam Sita Madhu Sashulam Raktapittotam Leadam Hanti Udaramyam. In the Udara condition, that Koshakara with the Grita. Koshakara word as such is suggestive about the shells of some insects, but in Sushruta, Dhallana has mentioned Koshakara is a Ikshubheda, a variety of Ikshu, sugarcane. So that has very clearly understood. Otherwise, in general, Koshakara suggests about the nests of insects. So anyway, that's one of the issue, and these could be used for udara, that chronic diarrhea conditions can be corrected. Bilomadhyam samadhukam sharkara kshaudha samyutam tandulam yuto yogaha pitta raktothitam jayeta. Another of the yoga in pitta raktaja vyathi. Yogan sangrahikan cha anyan pibet sakshaudha sharkara negrodhadisha puryat cha putapaka nyatharitana. Putapaka with the negrodhadigana is the general suggestion. Budapake ye uktaha te atrapi vidhaya smritaha. All the Budapaka mentioned protocol also can be used in the treatment of chronic conditions. Tujam cha aprashamyantyam pichabhastihi to bhaveta. If there is a resistant condition and continuous persisting pain, in that condition pichabhasti is suggested. Sakta bit dosha bahulam deepagniyo atisarite vidanga trifala krishna kashayi hitam virejayeta athava yeranda siddhena payasa kevalena va yavaguhu vitaretya asya vatagnehi dipane kritaha. If the patient develops constipation and the patient has good appetite after the atisara, in such conditions patient can be given virechana with vidanga trifala kashaya, etc. Virechana can be given. Deepagnihi nishpurisho yah sarite prenilam shakarva sapibet panitam shunti daditela payogritam. If at the end of diarrhea, the patient is having only a mucus discharge but not fecal contents, which again is usually seen in dysentery, In such conditions, Sushila has suggested a yoga of Panita with the Shunti, Dadi, Taila, etc. Sinnani Pistavadvapi Samam Bilushalatu Bihi Dadna Vipayja Kulmashan Shwetam Anupivet Suram. Other pachas like Bilushalatu, the tender leaves of Bilwa, or with Dadi, and Kulmasha is again a food preparation, something like idli, and with the sura, alcoholic beverages. Shashamamsam, Sarudhiram, Samangam, Sakritam, Dadi, Khade, Vipachya Seveta, Mrudvanam, Shakratakshe, rabbit's flesh with the blood and Samanga, that's not mimosa, Udika, and Ghrita, Dadi, etc., they have to be eaten, given as a food. संस्कृतो यमके माश यवकोलरसः शुभः भोजनार्थं प्रदातव्यो दधि दाडिमसादितः माश यवकोल these also can be given with the दधि बिल्वशालाटुनि नागरं च अम्लपेशितं दत्तः सरश्च यमके भ्रष्टो वर्चक्षये हितः. Another of the yoga for varchakshaya, that's the chronic complications of the diarrhea. वायुप्रवृत्तो निचितं बलासं नुदति अधस्ताद् अहिताशनस्य प्रवाहमाणस्य मुहुर्मलाक्तं प्रवाहिकान्तान् प्रवदन्ति रज्ञाः. Such conditions where the patient passes the mucus after the episode of diarrhea is called as pravahika, which we now call as a dysentery. Pravahika is the specific name given there. Pravahika vatakrita sashula pittat sadaha sakapa kapacha सशोणिता शोणितसंभवातो स्नेह ताः स्नेहरूक्षप्रभवाः मतास्तु तासाम् अतिसारवत् आदिशेच्च लिंगं क्रमं चाम इवक्वतां च. Now in all cases of pravahika where the patient has mucus discharges, dysentery conditions, the protocols of the treatment of atisara have to be followed, and mainly you have to consider the ama ivakka condition. न शांतिम आयाति विरंगनीया योगैः उदीर्णाः यदि पाचनैश्च तं क्षीरमेवाशुश्रुतं निहन्ति तैलं तिलाः पिच्छिलबस्तयश्च. If the patient doesn't respond to the langhana and the other yogas, in such conditions picha basti is suggested, and the patient has to be given oral milk and milk products. That's exactly what happens in case of Crohn's disease, ulcerative colitis like conditions, and how we treat the conditions. आर्द्रैः कुशैः सम्परिवेष्टितानि वृन्तानि अध आर्द्राणि च शाल्मलीनां पक्वानि सम्यक् पुटुपयोगेन आपूर्च्यतेभ्यो रसमादधीत. क्षीरं श्रितं तैलहविः विमिष्टं तल्केन यश्चि मधुकस्य वापि बस्तिं विदध्यात् विषकप्रमत्तः प्रवाहिका मूत्रपुरीश्रव्ये तैलेन युज्यात् अनुवासनं च. Another of yoga which could be presented either in the form of a pichabasti, where the kusha dravya are used, kashaya rasa dravya, the kusha vrunta is used, shalmali, etc. Or it also can be used in the form of anuvasana by preparing taila. Vatagna varge lavaneshitaiva tailam sasiddham hitam annapane. Patient has to be given the food which contains vatagna gana dravya and lavana taila. Lodham vidam bilvashalatutaiva dikshatya tailena katutrikadhyam. A trikatu ghृता is another of the yoga which could be given. दध्ना ससारेण समाक्षिकेण भुञ्जीत निस्सारकपीडितस्तु सुतप्तकुप्यक्वथितेन वापि क्षीरेण शीतेन मधुप्लुतेन शूलार्जितो व्योष विलारिगन्धा सिद्धेन दुग्धेन हिताय भोज्यः वातग्नसाङ्ग्राहिकदीपनीः कृतान् षडांश्च अपि उपभोजयेच्च खाद्यच्च मत्स्यान् रसमाप्नुयाच्च वातग्नसिद्धं सघृतं सतैलं येणाव्यजानां वटप्रबालैः सिद्धार्थानि सार्धं पिष्टानि खादेत मेध्यस्य सिद्धं तद् अधरक्तं बस्तयश्च बस्तस्य दध्ना घृततैलयुक्तं खादेत प्रदेहे शिखिलावधीर्वा भुञ्जीत योषैः दधिभिश्च मुख्यैः माशान् सुसिद्धान् कृतमण्डयुक्तान् खाद्यच्च दध्ना मरिच उपदंशान्. The different varieties of the options of the food are suggested. Either it could be vegetarian or non-vegetarian, where it could be like the shada. Shada is something like ganji, a thicker ganji, and it could be prepared with the dadna sasara. Dadna sara is a wave water with the makshika, that's honey, and so on. Or it could be the fleshes of yena, avi, aja. Yena, rabbits, avi, sheep, aja, goats, fleshes are could be given, or it could be the fleshes of the birds like shikhi lavajaiva. Shikhi is a peacock flesh, also could be given as a food. महारुजे मूत्रकृच्छे भिषक् बस्तिं प्रलापयेत् पयो मधुकृतोन्मिश्रं मधुक उत्पलसाधितं सबस्ति शमेत् तस्य रक्तं दाहम् अथो ज्वरम्. If there is a severe pain and the patient has a dysuria, in such conditions basti is suggested, and the basti with the payo madhukrita. Madhuraushadha siddham kahitam tasya anuvasanam ratrau ahanimantyam rujarto yo bhaven naraha. If there is a persistent pain, a anuvasana basti with madhuraushadha can be suggested. यथा यथा सतैलः स्यात् वातशान्तिः तथा तथा प्रशान्ते मारुते चापि शान्तिं याति प्रवाहिका. तस्मात् प्रवाहिका रोगे मारुतं शमेत् भिषक. In all such प्रवाहिका or dysentery conditions, the main target would be treating vata, because the vata has to be controlled, and the vata is better controlled with the taila in the form of basti. वनवासन बस्ति पाठ अजमोद कुटजोत्पलं च शुण्ठी समाह मागधिकाश्च पिष्टाः सुखां पीताः शमयन्ति रोगं मेथ्याण्डसिद्धं सघृतं पयोवा. The another of yoga which could be used where shunti magadika is pippali, these can be given. Shuntim ghृतं सक्षबकं सतैलं विपाच्य लीढ्वा आमयमाशहन्यात् धारोष्ण दुग्धस्य लघूनि पथ्यानि अथ दीपदानि स्निग्धानि भोजानि उदरामेषु. Sorry, there is a typing error. धारोष्ण दुग्धस्य तथा च पानं. Then लघूनि पथ्यानि अथ दीपदानि स्निग्धानि भोज्यानि उदरामेषु हिताय नित्यं वितरे विभज्य योगांश सांस्थान भिषक प्रमत्तः. The other options are shuntikrita etc. And लघु पथ्य दीपन आहार स्निग्ध आहार has to be given. रुक्षात् जाते क्रिया स्निग्धा रुक्षा स्नेह निमित्तजे भयजे सांत्वना पूर्व शोकजे शोकनाशिनी विष अर्ष कृमि संभूते हिताचे उभय शर्मदा. Now in case of ruksha dravya induced, that fat food induced conditions, a sneha has to be given, and if it is due to sneha dravya, consumption of excess of sneha dravya, a rukshana has to be given. If the patient has diarrhea due to bhaya, then santvana purva consolation counseling is required. Shokaja shokanashini, in the sorrow induced, that sorrow has to be avoided. Visha krimi sambhuta, visha or krimi or ashras, the specific treatment has to be followed. Samavayetu doshanam purvam pittum upacharetu jvare chaiva atisare cha sarvatra anyatra marutam. If there are multiple doshas and you are not able to make out which dosha is the predominant one, in all jvara and atisara, pitta is the main target, whereas in all other diseases, vata is the main target. Karmajaha vyadhe kechit doshajaha santi chapade karma doshodbhavash anye. The atisara also could be produced to karma, that is a purajanma karma, and in such conditions the treatment would be karmajastu yeshu ahetukaha, where you may not have a specific reason and the patient has to suffer. Nashyantu akriyabhihi te kriyabhi karma sankshaye. All the protocols of the treatment may help in reducing the symptoms but may not get cured till his purajanma karma is resolved. Now this is a controversial issue, whether this is true or not is something which is again controversial, but there are certain conditions which are intractable and cannot be cured, and they have to be managed with the symptomatic treatment. Shamyanti dosha sambhutaha dosha kshay hetubhihi. If the disease is produced to dosha vikriti, they can be cured with all the protocols of the treatment. Atisare nivartepi mandagneha haichashanaha bhuya sandushito vanye grahanim abhidushet tasmat karyaha pariharastu atisare viriktavat yavanna pratistasya doshata pranatastatha. Even after having a clinical relief of atisara, patient may continue to have a impaired digestion and it can result in grahani vyadhi, and hence the patient has to be taken care of as you do for virechana. The sandukshana krama has to be followed, samsarjana krama has to be followed. Now grahani is shashti pittadhara nama yakala parikirtita pakvasha madhyastha grahani sa prakirtita. Grahani is the mucus or the structure which is in between amasha and pakvashaya, that's maybe the duodenum like area, where majority of the digestive juices are added, and that area is considered as grahani. ग्रहण्याः बलम् अग्निर्हि स चापि ग्रहणीं श्रुतः तस्मात् सन्दूषिते वह्नौ ग्रहणी सम्प्रदुष्यति एकशः सर्वशश्चैव दोषैः अत्यक्तमुच्यते हि सा दुष्टा बहुशो भुक्तम् आमयेव विमुञ्चति पक्वं वा सरुजं पूति मुहुर्बद्धं मुहुर्ध्रुवं ग्रहणी रोगम् आहुः तम् आयुर्वेदविदो जनाः ग्रहणी रोग Sushruta now comes to that point, which is one of the possible complications of Atisara, where the patient would have a malabsorption, persistent malabsorption conditions. In such conditions, because the whole absorption is depending upon that grahani area, that functions of the grahani area, digestive uses, and when it results in such complications, the patient would pass the stools which are not really digested, and the patient fails to absorb, and that's what we call as a malabsorption syndromes. Now, a large number of conditions are called as a malabsorption syndromes, or it's also named other way. Another name is a bile-induced diarrhea-like conditions. And in such conditions, the clinical symptoms will be tasya bhuktatva vidaho anye sadana alasya trittamaha balakshayo aruchi kasa karnakshvedo antrapujanam. As a result of that, the patient would have emaciation, impaired appetite, cough, and the karnakshveda, more waxes in the ear. अथ जाते भवेत् जन्तुः शूनपादकरकृशः पर्वरुक् लौल्य त्रिटुत् छर्दि ज्वर अरोचकदाह्वान् उद्गिरेत् शुक्त तिक्त अम्ल लोह धूम आमगन्धिकं प्रसेक मुखवैलस्य तमक अरुचिपीडिताः. One of the most important complications of all this malabsorption would be protein energy malnourishment results in the edema, a generalized edema. Shunapadakaraha, hypoproteinemia causes or results, and the patient may have the other systemic symptoms like pain in the joints, excess of thirst, vomiting, and irregular appetite, and the general debility. Now that's exactly the clinical symptoms of malabsorption condition. Whatever the grahani roga mentioned by Sushruta is the same malabsorption pathologies which could occur. Now from the current point of view, malabsorption syndromes are a huge number of disorders, which is a separate chapter by itself, and majority of those are mainly due to the dietary abnormalities or overuse of the drugs. वातात् शूलादिकैः पायु हृत्पार्श्व उदरमस्तकैः पित्तात् सलाैः गुरुभिः कफात् त्रिभ्यः त्रिलक्षणैः. Vataja condition would present with the pain, and Pittaja condition would present with the burning sensation. Kaphaja condition would be presented with the edema, as well as the Tridosha condition could be presented with all the lakshanas. Dosha varnaihi, nakhaihi, tadvat binmutra enanaihi, hritpand udara gulmasha pliha shankija manoha. These patients may have a clinical presentation which leads to the suspicion of cardiac pathologies or other abdominal mass pathologies or splenomegaly-like conditions. यथा दोषोच्चयन्तस्य विशुद्धस्य यथाक्रमं पेयादिं वितरेत् सम्यक् दीपनीय उपसंहृतं तथा पाचनसंग्राही दीपनीय गणत्रयं पिबेत् प्रातः सुरा अरिष्ट मेह मूत्र मुख सुखाम्बुभिः तक्रेण वा अथ तक्रम वा केवलं हितमुच्यते कृमि गुल्म उदर अर्शोग्निः क्रियाश्चात्र अवचारयेत् चूर्णं हिङ्गवादिकं चात्र घृतं च प्लेहनाशनम्. In all such conditions of malabsorption, the treatment has to be prolonged, and mainly the treatment has to be Deepaniya Dravyas, Diban and Sangrahi Dravyas, Pachana, Sangrahana, Deepana. These are the major contents which are to be given. Takra or buttermilk is considered one of the most important option for the diet as well as the medicine. Kalkena Magadhadeshcha, Changeri Swarsenacha, Chaturgudena Dadnacha, Gazam Siddham Hidam Bhaveta. A Changeri Krita is another of the indication drugs. Sarvata Deepanam Sarvam Grahani Roginam Hidam Jaradin Avirodhacha Sariyet Svehi Chikitsidehi. The Deepana is the main line of treatment in all Grahani. If the patient has developed other complications like Jwara, they have to be treated as per the symptoms. Now, with that, the description of Sushruta is completed. From the current point of view, the major important issue in all management of diarrhea and diarrhea related conditions, I will not go into very significant detail, but major issue is the dehydration and the complications of the dehydration. As far as the dehydration complications are concerned, the oral rehydration therapy, the oral dehydration solution, has gained a lot of popularity and has produced a sea change in the outcome. And the WHO guideline is, in every diarrheal disorder, before you go for any specific protocol of the treatment, the patient has to be maintained, the nourishment, oral hydration has to be maintained, and the oral hydration, the standard combination of the oral hydration. Earlier it was what we call as a standard WHO ORS. Now very recently it has started a reduced osmolarity ORS, the combinations where the glucose content and the osmolarity of the fluid is somewhat reduced from 311 to 245. So a dilute oral solution, whatever we get now in the market are the same, the new formula, which is the ideal drug, and the credit of making use of this, publishing this oral rehydration and making it popular goes to an Indian pediatrician, Mahabilis, and he is given a lot of recognition there. And this is one of the important issues. In every patient of dehydration, particularly every patient of diarrhea, particularly in children, dehydration is a major issue which requires a specific treatment. And the hydration has to be done either preferably by giving oral, and the oral rehydration, the same solution which should be, but the quantity could be, and the assessment of the dehydration, I think assessment of the dehydration we have already discussed, like, and the approximate amount of oral solution which has to be given in the first 4 hours of the diarrhea would be based upon the body weight and the age, and ideally if the child is less than 4 months and the body weight is less than 5 kg, it would be 200 to 400 ml in 4 hours, first 4 hours. Whereas if the age is between 4 to 11 months and weight is between 5 to 7.9 kg, 400 to 600 ml. If the child is 15 years or older and 30 kg or more, 2200 ml to 4000 ml, 4 liters can be given in the first 4 hours. So that's the important thing in administration of hydration, oral hydration. The quantity has to be determined and should be given in sufficient quantities as per the age and the weight. Suppose if there is a oral rehydration therapy has failed, then only, and the causes of the failure could be continuing rapid loss, like more than 15 to 20 ml per kilogram per hour, as occurs in some children with cholera, or insufficient intake of oral solution owing to some fatigue or lethargy if the child is not able to take that oral solution, and frequent severe vomiting. In such conditions only, oral solution either can be given by nasogastric Rayleigh tube, or a ringer's lactate IV can be given. This is one of the important protocol of correcting the updhatu or hydration is the important. For hydration, instead of giving simple plain water, that's the important issue. You should give the substances which have the osmolarity, and the current trend is to give less osmolar substance like the new ORS solution as such. And if at all IV fluids have to be given, particularly in children, and adults doesn't make much, but in children, if the patient is dehydrated and if at all you have to give that IV fluid and severe dehydration, then the first dose initially give 30 milligram per kilogram in 1 hour, and if the child is infant, and if the child is older, the same can be given at 30 for the 30 minutes. Then the rate has to be increased to 70 milliliter per kilogram in next 5 hours, and 2.5 in children, adults later it could be 2.5 hours. That rate of infusion in children is important when you administer IV fluids. In adults, a slight variation doesn't make much difference, but pediatric practices and administration of fluid, that rate of infusion is very critical, and that has to be trained. The other aspects of the treatment protocol, current trends, in the current trends, the administration of zinc is publicized a lot, and it is considered as an oral drug, and a lot of stress is given, lot of publicity is given for administration of zinc as a supplement in case of diarrhea, but I still have a doubt about that utility. Then another variation is, earlier antibiotics were not really suggested in the treatment of diarrhea-like conditions, But now these days antibiotics are freely prescribed in case of diarrhea. And one of the major issue is antibiotics would be later on it results in lack of the or maybe destruction of the bowel, the commensals, the bacterial colonies in the intestines, the intestinal the environment would be affected, and then you give lactobacillus. That's and one of the controversial issue. See, pectin was earlier used, pectin and with the cavalin earlier was used, which would help in absorption of water from the body and give a formed stools. But and it was a very useful drug, and it is used withdrawn from human uses since 2004. And considering that this is useless, but still it is used in veterinary practice. Opium and loperamide like drugs are the other drugs which are very frequently used, and even now they are sold like over-the-counter drugs, and they are misused. And one of the major complications of this loperamide and opium like drugs would be a persistent chronic intestinal adenamicity, abnormal movement, and it also can be a cause for the dysenergy. The most of the dysenergy patient conditions would occur due to the irregular use of that loperamide like drugs, loperamide or opium derivatives, other lots of other drugs. And from considering all these issues, Ayurvedic prescriptions definitely have an upper edge in the treatment of diarrheal disorders, particularly acute and chronic in both. In acute conditions, my preference would be Agnitundi Anandvere Mustrakarishta. Of course, the hydration, status of hydration, and if necessary, the hydration is an essential part, no question of variation, but this would be a better drug. If the patient has IBS chronic, then Smithsagara is indicated. Patients like ulcerative colitis like conditions, pitch up is the other options which can be often used, and definitely this treatment would be much better than otherwise. With this, we'll conclude, and the chronic diarrhea differential diagnosis would be again one of the important issue. In the patients who have chronic diarrhea, the causes could be either inflammatory or osmotic or secretory and dysmotility. Dysmotility is mainly due to the medications, drugs which are given, and infective patients like bacillary this amoebic colitis may continue to have a chronic condition. So when a patient presents with chronic diarrhea, it's not that every patient has ulcerative colitis or Crohn's disease. So you will have to rule out all these issues, take a history, maybe if necessary go for the investigations, and the inflammatory pathologies, either infectious like giardiasis or amoebiasis, or non-infectious conditions, ischemia, irritable bowel disorders, radiation-induced conditions, malignancies, osmotic pathologies where either it's lactose intolerance, which is again quite frequent in children. Medicines, many medicines can induce the diarrhea-like condition. I'll come to that part. Then bacterial overgrowth due to that use of antibiotics, one of the important issues. Celiac disorders like ulcerative colitis and so on, pancreatic insufficiency, secretory disorders like carcinoid and carcinoma, which are comparatively less common. So hence the important is the treatment protocol would be varying according to these issues. It's not that every patient is given the same drug which I have suggested, but as a symptomatic drug, Anandvere Mustrakarishta can be given, but underlying pathologies have to be clearly understood, and the treatment protocol has to be planned. Going into that detail would be out of question. Like medications which are commonly associated with the diarrhea. Now this is one of the issues. Frequently, majority of the patients whom we have of chronic these pathologies and malabsorption syndromes, symptoms at the level of malabsorption syndromes, would have some other medicines, and it is due to the medications. And the common drugs, list of the drugs which are known to produce diarrhea, which are associated with diarrhea, are the citrates, magnesium, sugar and alcohols, and secretory like antiarrhythmic drugs, quinine, antibiotics, malignant anti-malignant drugs, bicarbonate, that's the anti-diabetic drug, calcitonin, cardiac glycosides like digitalis, colchicine, and non-steroidal anti-inflammatory drugs, prostaglandins. Then motility affected is macrolides like erythromycin, metoclopramide, then bisacodyl like laxatives, and malabsorption induced conditions like acarbose, and aminoglycosides like gentamicin, etc. Then archisat and thyroid supplements, pseudomembranous colitis could be produced with antibiotics and antineoplastic drugs and immunosuppressants. Now, all these are the issues which you need to go into in detail, and then only plan the approach to go into that. Further description beyond the area, my purpose is only to sensitize about the issue. With this, we conclude. It is Sushil Samhitayam Uttartantramikate Kayachikisa Tantre Atisarapratishedha नाम द्वितीयोऽध्यायः आदितः चत्वारिंशोऽध्यायः. With this, we will conclude, and if there are any questions, we will try to answer. Right, okay, there are no questions, we will wind up. Thank you.